Davenport woman is hoping to get out of her hospital bed soon.
She's trying to understand what sent her there in the first place. Danielle Dunbar's first trip to the emergency room came after a heart attack in February. She was 23 years old at the time. Dunbar's now diagnosed with congestive heart failure, and problems with her lungs make it hard for her to breathe. Local 4's Sean Logging joins us live in the newsroom with her story. Sean?
Yes, Jim, Tiffany. While heart disease is most common among people in their 50s, 60s, and 70s, the American Heart Association says those in their 20s and 30s are not immune. Danielle Dunbar tells me after learning that, she's just trying to fathom why it's led to having a host of other health issues.
When they shocked me, I was awake. I was aware of it.
It was the shock of Danielle Dunbar's young life, being told she had a heart attack a month before turning 24.
I had a spontaneous lateral dissection. I think that's what they called it. But they don't know why I had it.
One of a list of whys she hopes can be answered at the University of Iowa hospitals and clinics.
I was perfectly healthy before. They did nothing wrong with me. I barely had a cold before I had a heart attack. And now I can't breathe.
The questions are mounting during a course of 3 months' time.
They're trying to decide if it's my lungs that's the problem or if it's my heart that's the problem.
And answers are coming slowly.
All my blood tests that I've had done are negative. All of my lab work, everything that they've done so far is negative. So they don't really know what's going on.
Danielle's mother, Melissa Mason-Garb, has her own list of whys.
All I do after work is go home and cry. I cry myself to sleep. I pray and I wonder, why did this happen to her? Why wasn't it me?
Week in, week out, stuck in a hospital bed, she says isn't who her daughter is.
She's working or out with the nieces, nephews, or sisters, brother.
So it's finding out how to stay positive.
If I don't make it funny, then it's sad. Because I have to face the fact that I could die right now.
And for Danielle, it's all leading to the question when she can have a normal life back.
Starting to feel like this is my life.
Danielle is scheduled to have a biopsy sometime this week. She tells me doctors hope that can provide them with some clues. There is a GoFundMe page to help with expenses. They actually tell me that helped them make their bills for this month. We'll have a link to that on ourquadcities.com. In the newsroom, Sean Logging, Local 4 News.